You know, there's a couple of things. One is we have to have incentives aligned. I think, you know, value-based arrangements are trying to get that solved, so everyone is aligned in terms of incentives and how they're rewarded in these activities. The other thing is the tools available, and we talk about that in the study we've done with the Inovalon, that physicians, even though they may have very sophisticated EMRs, you know, sometimes it's difficult to find the right information when you're with the patient to make the right decision to execute well on value-based arrangements. I think the provider-payer distinction is blurring. You know, I know a number of larger health systems are also, you know, getting into health plans, and some health plans are acquiring provider practices. So that distinction I don't think is as black and white as it was maybe 10 years ago. So there is a convergence of those activities. Secondarily, I think there are forces driving better alignment and collaboration. I think we all understand we have to get there together, and rolling up our sleeves and finding commonalities and getting those Venn diagrams identified where there is overlap and we can drive towards, you know, starting to get some successes under our belt. Well, that's the Rosetta Stone, right? That's really what we need to do. You know, when we partnered with Inovalon, for example, in data diagnostics, we brought Quest capabilities in the laboratory area, our data, but probably most importantly, our pipeline into physicians and interfaces with EHR. If you don't have that ability to get the data into the system the physician's using at the time they're seeing the patient, or a little bit before, it's going to be hard to make that information usable. And it has to be relevant, it has to be beneficial to the physician and patient, has to be real time, and it has to be very quick, right? Otherwise, physicians aren't going to use it.